So, everybody ready? Everybody ready?
How's that? Is that good?
All right, well, good morning. I'm Tab Bowling, and I'm honored to serve as the mayor of the city of Decatur. And I want to thank you for joining us this morning for a COVID-19 update. I am joined by Morgan County Commission Chairman Ray Long and Decatur Morgan Hospital CEO Nat Richardson.
Good morning.
Despite being on a modified administrative staffing plan, the city of Decatur will continue to serve its residents as we do each and every day. One of the first things that I want to talk about is a severe weather plan. We want to make our community aware of the severe weather threat we're monitoring for Tuesday. In the event that a tornado watch is issued, both Decatur High School and Austin High School will be open as secure shelters and staffed by the Decatur Police Department. The Alabama Department of Public Health says at this time your first priority should be to protect yourself from a tornado. If a warning is issued for our area, you will be more likely to be affected by the tornado than the virus. Now it's time to review your inclement weather plan. City operations, the City of Decatur Police Department and Decatur Fire and Rescue will continue responding to all calls and emergencies. Residents who need a non-emergency report filed with the Decatur Police Department may call 256-341-4600. That's 256-341-4600, and an officer will assist them over the phone. Trash collection will continue as normal on regularly scheduled dates and routes. Curbside recycling is temporarily suspended, and as soon as we know when services will resume, we will let you know. We would ask that if you plan on cutting your grass while you're working from home, please put any grass clippings in your yard waste bin for collection at this time. We ask that you not put brush and large debris out for collection at a later date. Point Mallard Campgrounds is still open at this time. Also, as it relates to doing business with City Hall, vendors, businesses, and contractors may still access City Hall by appointment. For a list of departmental contacts and phone numbers, please visit DecaturAlabamaUSA.com. We want to remind residents to stay home, practice distancing measures to the highest ability possible. I want to tell you that, I receive updates daily from Nat regarding our what's going on in our healthcare system, and you're going to hear some information here shortly, but I'm really, really proud of our residents and how they're responding. Continue to practice every day the preventative actions. Cover coughs and sneezes with a tissue, and wash your hands often with soap and water for at least 20 seconds. Honor the mandatory state health orders issued last week by avoiding large gatherings of 25 or more individuals. I think we had an opportunity to worship yesterday by streaming as a community, and that was really a nice opportunity and something we needed to do. In conclusion, I want to offer some encouragement and just remind that Decatur is a very diverse community of strong character and friendly spirits. It is in an unprecedented time like these that we're reminded of the values of sincerity, kindness, and compassion that we've built and sustained our community for 200 years. If you are healthy and able, check on your elderly neighbors, help where you can, even if it's just lending an ear for a quick phone call. Pick up a meal to support a local business, buy a gift card from your favorite independent retail store. It's an honor to serve as your mayor, and if you have any questions, please don't hesitate to call us here at City Hall. We're here to support one another now and always. I would ask that you join us again Wednesday at 10 o'clock for another municipal update. And now I'd like to turn it over to Chairman Long for an update from Morgan County.
Well, we're still just like we was last week. Everything's just on hold. Like I say, everybody knows we actually closed the courthouse Friday At lunch, we had one employee that had been tested for the virus. The results hadn't come back yet. We've been in completely cleaned those offices, so we opened back up today at noon for our employees. Courthouse still going to be closed to the public. If you need anything, like I say, call the agency, the department that you need, that you have questions with. Somebody will be there, to answer. So, just as the mayor said, just continue to stay safe, limit your contact with other people the most you can. Stay clean and stay healthy. Stay inside if you can.
Thank you, Chairman. Nat?
The hospital to date, we have tested 51 patients, and we have 16 that have come back negative. We have no positive results at this time, and we have 10 patients currently in the hospital that are under investigation. Their tests have been sent out, and we're waiting for those tests to come back in. I would say that there's been some confusion about one of our tents that's outside the hospital at the main campus, the Decatur Morgan campus. That tent is to make sure that the team members can go out and test individuals so that if they are suspicious, we can take them to into a different door into the hospital and segregate them in the emergency department. That is not a COVID-19 testing tent. It's just a tent to make sure that we can pre-screen before coming into the hospital so that we can keep them in an area and not contaminate other areas in the hospital if they were highly suspicious of COVID-19. We will also be opening up a flu and fever clinic in Hartselle on tomorrow. Again, that's not a COVID-19 testing site. It's a fever and flu clinic to test individuals, and then if they need further testing, we would then refer them to a site that could test them for COVID-19.
Where is that? Yeah, okay. Where in Hartselle?
It's going to be currently where Dr. Lindsay Smith office is. We can get you information, and we'll have that on our website soon, sometime this afternoon.
How is the hospital looking supplies-wise?
Supplies, we are okay. We, of course, always need more N95 masks and any type of gownings and things like that. We have been working with our elected officials. They've been great to respond and connect us with various vendors out there that have those types of equipment.
Has been okay on swabs?
Yes. Now, we still need more testing kits, and that hopefully will come later or midweek. As you know, there was one big shipment that was diverted to Washington State and New York, which makes sense, but we hope to get a shipment in so that we can do more testing in our state sometime midweek.
Has that put you guys behind so far on how many people you can test by that shipment, going elsewhere?
I would say for certain areas here in North Alabama, although we're testing, I wouldn't say that we're behind. We certainly would need more tests, but we're not seeing the surge that many of the other areas are seeing right now. Our surge seems to be about moderate. For instance, we're not overwhelmed in the hospital right now with volume. We do have people coming in. I would say we've averaged about 3 to 4 each day additional people that are coming in for testing.
Is the curbside registration you guys are doing outside the hospital, is it effective for what's going on inside?
Yes, very effective. When we can curbside register you and get all of that information in, then you go directly into that department where you need the test versus having to sit in a waiting area and not be able to practice the distancing.
What's the hospital's preparation like for tomorrow? With severe weather potentially coming to our area, how are you guys preparing for this?
Well, the hospitals have always been prepared for severe weather, and we will implement our standard protocols for severe weather, and we'll determine once that weather is here whether we call a specific type of code. We have different codes that we call depending on what type of weather it is, and that's been standard, and we will implement that if necessary.
Talk about the importance of preparing for severe weather and making sure that people know that they do need to take shelter if needed. That COVID-19 isn't a reason to not seek shelter during severe weather.
Right. Of course, any type of severe weather, you want to watch the meteorologists, understand where that weather is going to potentially, where it will impact, in the areas that it will impact. In the hospital, as I stated, we have certain protocols that we utilize lockdown protocols, and any other types of information we need to get out to not just our staff members that are in the hospital, but staff members who may be home that we need to call in those situations.
Let's say the threat is present tomorrow and people need to congregate in one of the shelters. Does it pose a serious threat to your own health, being in, close quarters with one another at a time like this?
Well, anytime I would say in the situation where you have bad weather, that's going to potentially force you to be closer than the recommended standard when you include the COVID-19 restrictions. But in those situations, it is my opinion that that is a severe weather situation and you're going to have to, for that period of time, be in close quarters.
Let me say that also, we have shelters all over the county, probably 20 stationed out in different areas, and we sent out an email yesterday for people that's managing those shelters to put a sign up and let people know that they're going to be open if we have a tornado, but also with a warning that you put yourself at risk if you decide to go against the warning that everybody says not over 25 people. Most of our shelters will hold between 96, 98 people if you come in. So, as Nate said, if your storm's coming, it's better to set that COVID-19 aside and get in a shelter because, we know a tornado will damage you, or we still worried about the COVID-19. So our shelters will be open. We've asked all of them to be open, but at least put the sign up to let people know that we can't guarantee the 6 feet apart.
Mayor Bowling, this question is for you. The Surgeon General said, this could be one of our hardest weeks in history with numbers going up. How is the city of Decatur prepared for a potential spike in cases?
So, of course, our healthcare provider will take care of most of those, as I understand your question. As a government, and to keep the government, the longevity of the government in place, today we went and started a modified operational staffing plan so that we do not have all of our employees here at City Hall on a daily basis. So if we end up having some illnesses within our staff, then we have those that are being on hold, ready to come in and keep the city moving well.
Are there any other, protocols you guys might be calling for in the next couple of days?
So we have a disease task force, Morgan County Contagious Disease Task Force, and they are working on those items and would be better prepared to answer those questions for you. My job relates to this, and the question that you're asking, the information that I have now is what I just shared with you.
Last week, your city council members implemented a state of emergency for the city of Decatur. What are your thoughts on that? Is that the right way to go about this? And explain, what additional resources enacting a state of emergency provides for the city and the people of Decatur?
Sure. So the state of emergency gives us some abilities, purchasing authority, spending authorities that we would normally need to go through council. Now, we still communicate with council and likewise council with the office of the mayor, but it just frees up, and it also puts us in a position to begin as far as expenses are concerned for FEMA reimbursements. So it helps us with that. In regards to the city council and our planning commission, just public hearings as a whole, encourage viewers to be prepared to watch those meetings via YouTube, City Decatur AL, and do a search there. And then for public hearings, there will be a speakerphone in the council chamber for those that need to call in. They can call in and take care of business that way. Now, those that have business before the city government will be able to come into the council chamber, but it will be kind of maybe one at a time, just so that we stay within the guidelines.
How have the residents of Decatur reacted or, responded to what the governor put in place last week about closing restaurants and, different facilities shutting down?
They're responding in just a very favorable way. They're really trying to help our restaurants as much as they can. I had my head in the sand the other day, Friday, and went in a restaurant, and I'm ashamed to tell this, probably shouldn't, but I left a tip, and for to-go orders, I don't tip like I do for sit down and stay order, but I went back and made that up Saturday because our servers, they're taking a little bump right now. We want to be, we are a generous community, and I'm just really, as I mentioned earlier, proud of the way that everyone's responding.
Yeah, and have you spoken with business owners here in Decatur? How are they responding? What are you kind of doing to help keep them afloat during this time?
Well, we are staying in touch with our business community. They are resilient. They're doing the best they can with the staffing that they can. Some are looking possibly for SBA disaster loans that are available. And I think that's the best I can answer your question.
Decatur Morgan Hospital, how many ventilators do you have and how many are already being used?
Right, we use on average about 5 ventilators, and we have a warehouse, because we're part of Huntsville Hospital Health System, we have access to a lot of ventilators, but right now we're utilizing about 5 ventilators.
Okay. And have any hospital employees tested for COVID-19? Is that like a routine thing that they get tested, or have there been any hospital employees that have been symptomatic?
We have had a couple of team members that have been tested. Those have come back negative. And we are also, when you come into the hospital, testing individuals for their temperatures. So if you come through any of our entrances, you would get tested for your temperature, and if it was over 100.4, we would then try to get you referred for further testing.
Could you walk us through the process of, let's say a potential, coronavirus patient walks into your facility? What is the protocol for taking action for a nurse? What is, the immediate response to that?
Well, first is screening, because we're not going to know whether or not they are a coronavirus patient until we test them. So you do a screen first, and that screen will ask all of the questions that we've been given as far as guidelines through the CDC and the Department of Health. If they meet the criteria, then we would take a swab from the patient and we'd send it off to be tested to determine whether or not they had COVID-19. Those results are called back from the state or that testing site to the physician, and the physician is communicating with the patient.
We have not reached peak yet, at least in the United States. They're saying about 40 days until we reach the peak. You said right now, you're good on PPE and other equipment, but does this worry you that, this isn't the highest volume you're going to see, that it's potentially going to get worse?
It is concerning, but it also gives us time to plan. So because we haven't surged, right now we're doing everything we can to plan for a potential surge, and the further out that is as far as the testing and more surge from patients, it gives us time to plan.
For the fever and flu clinic tomorrow, we've been covering a bunch of them in Huntsville, in Athens. If somebody has the potential, they think they do have coronavirus, can they get swabbed at the Hartsville Clinic for that tomorrow?
They'll be able to, the swabbing, they would go to a different place. Remember, we're going to do just screening for fever and flu. If there's a suspicion of COVID-19, then we would refer them to a site that tests for COVID-19, where they have the collection sample and can send that off to the state or a lab for testing.
Got it.
How long do the results usually take? I know they vary depending on where you go, but what are you seeing at Decatur Morgan Hospital as results come back?
Anywhere between 24 and 48 hours.
Yeah, and initially you had said there were 51 tests done, you had 16 back that all came in negative. Does that mean the rest of those 51 haven't come back yet?
Not necessarily, because they may be communicating those results directly. These are patients that, of course, that may have been sent home. Once they get sent home for quarantine, then those results would be called to them directly.
So how would we know if there are cases then? We wouldn't?
We wouldn't know unless the patient told us.
So there could potentially be more cases in our area that we do not know of.
That's correct.
So listen, I want to thank you for being with us today, and again ask you to join us on Wednesday at 10 a.m. for another update from City of Decatur, Morgan County, and Decatur Morgan Hospital. Thank you so much.
Department of Public Health has to report that, they have to report those numbers.
Yes, they would if there was a case for Morgan County, so if there was a resident that